So it's time for the revision. I hope most of you have already read the pharmacology subject once, and now we are going to revise this pharmacology topic by topic, right? So let's start with first topic, autonomic nervous system. And in autonomic nervous system, three MCQs will be asked from this topic of autonomic nervous system. The most important topic is anti-glaucoma drugs. So anti-glaucoma drugs will be asked very frequently in your exams. Even this you can expect to have one MCQ from this topic. Second is you can read about cholinergic drugs. So they ask one question from cholinergic drugs also. And in cholinergic drugs, most of the time they ask organophosphate poisoning. So be careful when they ask organophosphate poisoning, ready to answer all questions related to organophosphate poisoning. And third thing they can ask you is anticholinergic drug side effect. So anticholinergic drug side effects can also be asked. So side effects of anticholinergic, anti-glaucoma drug, cholinergic drugs, these three topics are important in autonomic nervous system. That autonomic nervous system is the one that will supply our involuntary muscles. So autonomic nerves are those which supply our involuntary muscles. Now these nerves which supply involuntary muscle or the autonomic nerves can be of two types, can be sympathetic nerves, can be parasympathetic nerves. Now although we have two types of autonomic nerves, sympathetic and parasympathetic, but at a given point of time only one system will work. So during the stressful events of our life, sympathetic system will work, parasympathetic remains switched off. And when we are not in stress, or most of the time of the day when we are not in stress, parasympathetic system remain activated all the time and sympathetic will not work. So stressful stimulus starts with S, sympathetic starts with S. So sympathetic for stressful event, parasympathetic for non-stressful. Now sympathetic nervous system is also known as thoracolumbar outflow because sympathetic nerves mostly come out of spinal cord from thoracic and the lumbar region. And this thoracic lumbar region is T1 to T12, 12 vertebra, and L1 to L3, 3 vertebra, from where these lumbar nerves will come out, and these lumbar nerves will form a plexus over here. We call it lumbar plexus. So lumbar plexus is an example of sympathetic plexus. If we talk about parasympathetic is known as craniosacral outflow. So one part is cranial part, second part is sacral part. So cranial nerves which are known as parasympathetic nerves are cranial nerve number 3, 7, 9 and 10. So cranial nerve number 3, 7, 9, 10 are the parasympathetic nerve, and the sacral nerves are coming out from S2 to S4 vertebra, and they again form a plexus. We call it sacral plexus. Now please remember, sympathetic system is also known as adrenergic system because in sympathetic nervous system the neurotransmitter is noradrenaline. That's why the system is known as sympathetic. That's why the system is known as adrenergic system. But parasympathetic system is known as cholinergic system because the neurotransmitter is acetylcholine. Now we'll discuss in sympathetic system how noradrenaline synthesis will take place, and in parasympathetic system how cholinergic system, how this acetylcholine synthesis will take place. So if we talk about acetylcholine synthesis first, acetylcholine synthesis, acetyl combines with choline and forms acetylcholine. So acetyl combines with choline and forms acetylcholine, and this acetylcholine will be stored in vesicle, and whenever body requires this acetylcholine is released. We have three medicines which will act on this acetylcholine synthesis pathway and interfere with the release or the synthesis of acetylcholine. The first drug is hemicolinium. Hemicolinium is a drug which is choline uptake blocker. So hemicolinium is a medicine which is choline uptake blocker. Vesamicol is a drug which is acetylcholine storage blocker. It is a blocker of vesicle. So hemicholine is having the word choline, it's a half choline, it's a blocker of choline uptake. Vesamicol is now having the word VES, so it will act on vesicle, inhibit the acetylcholine storage. Now we have a medicine, botulinum toxin. Botulinum toxin is a drug which is more famous known as Botox, the brand name Botox. And this medicine we have obtained from Clostridium bacteria. We have obtained this medicine from Clostridium bacteria, and this medicine acts by inhibiting the fusion proteins. So this medicine inhibit the fusion proteins like the snare protein or the snap proteins. So we have fusion proteins like snare and the snap protein, and when we block this fusion protein, then calcium entry is not possible. And when this calcium entry is not possible, then acetylcholine will not be released from this. Acetylcholine will not be released from the nerve ending. Botulinum toxin, inhibitor of fusion protein, inhibit the fusion proteins like SNARE and the SNAP and blocks the calcium entry, and when this calcium entry will not take place, then acetylcholine release will not occur. The other pathway, the noradrenaline synthesis pathway. So if we talk about noradrenaline synthesis, this noradrenaline synthesis starts with tyrosine. So tyrosine converted to DOPA, DOPA is then converted to dopamine, and dopamine is then shifted to vesicle. So this is the nerve vesicle. So dopamine is shifted to vesicle, and inside the vesicle, dopamine is converted to noradrenaline, and whenever required, noradrenaline is released. So this is the noradrenaline synthesis pathway. Tyrosine to DOPA, DOPA to dopamine, and dopamine is then converted to noradrenaline. Two enzymes are required for this conversion. One is known as TH. TH stands for tyrosine hydroxylase, which is a rate limiting enzyme in conversion of tyrosine to DOPA. The second enzyme is DOPA decarboxylase enzyme, which is required for conversion of DOPA to dopamine. Now we have some drugs which will act on this pathway just like the acetylcholine pathway. One is metyrosine. Now metyrosine is a drug which is having the word tyrosine in its name. So this is blocker of tyrosine hydroxylase enzyme, which is a rate limiting enzyme. And when we block this rate limiting enzyme, then acetylcholine synthesis will not take place in the body. Not acetylcholine synthesis, make up pardon for this. Metyrosine is a drug which is tyrosine hydroxylase inhibitor and therefore block the synthesis of noradrenaline in this sympathetic pathway, and medicine is given for the treatment of pheochromocytoma, which is a cancer of adrenal medulla, and in this cancer the synthesis of epinephrine and norepinephrine is very high. So metyrosine is the drug blocker of tyrosine hydroxylase given for the treatment of pheochromocytoma. Now we have some drugs like methyl dopa and carbidopa. So these medicines are having the word dopa. So they are blocker of an enzyme. The name of the enzyme starts with the word dopa. So dopa medicines are blocker of dopa decarboxylase enzyme. So methyl dopa, carbidopa, blocker of dopa decarboxylase enzyme. Now we have two more medicines like valbenazine and tetrabenazine. So valbenazine, tetrabenazine, these medicines will act on vesicle of this noradrenaline. So dopamine and noradrenaline are present in vesicle. So this vesicle is blocked by tetrabenazine and valbenazine. So tetrabenazine, valbenazine are two medicines which block this vesicle of noradrenaline, and these medicines are known as dopamine depleters. So we made mnemonic during our class. We made the mnemonic. This is a TV. So TV stands for tetrabenazine and valbenazine, and these medicines are given for the treatment of hyperkinetic body movements like chorea, rabbit syndrome and tic syndrome, right? So chorea, rabbit syndrome and tic syndrome, these are the hyperkinetic disorders. So we made the mnemonic that in TV we will watch a rabbit channel, a channel where the logo is having the rabbit. We will watch that channel chori chori. So CHOR is for chorea, so it's for chori chori, right? So we'll watch this rabbit wala channel chori chori on TV. So tetrabenazine, valbenazine are given for rabbit syndrome as well as for chorea. So tardive dyskinesia, we use this medicine tetrabenazine and valbenazine. Now we have, after that we have discussed about the metabolism of acetylcholine and noradrenaline. Acetylcholine metabolism will take place with the help of only single enzyme, acetylcholine esterase enzyme, which has two active sites in its structure. One is known as anionic site, the second is known as esteric site. But if we talk about noradrenaline metabolism, this metabolism requires two enzymes. So acetylcholine requires one enzyme, noradrenaline requires two enzymes, and these two enzymes are MAO and COMT. The main enzyme is MAO enzyme, which is required for metabolism of 80% of noradrenaline, and MAO enzyme will metabolize this noradrenaline 80% after its reuptake. So whatever noradrenaline is released, this noradrenaline will come back to the nerve first. So noradrenaline, whatever is released, it will come back to the nerve first by the reuptake phenomena, and this reuptake is possible with the help of a neurotransmitter. We call it noradrenaline transporter. So with the help of this noradrenaline transporter, noradrenaline will come back to the same nerve, and followed by it is metabolized by MAO enzyme. So acetylcholine metabolism by one enzyme, acetylcholine esterase, which has two sites, but noradrenaline is metabolized by two enzymes, MAO and COMT enzyme. Now after that we have discussed about different types of receptors of sympathetic and parasympathetic system. So we know that noradrenaline is a part of sympathetic and acetylcholine is a part of parasympathetic. So in parasympathetic system, acetylcholine will act on muscarinic receptor or nicotine receptor. So there are 5 types of muscarinic receptor, M1 to M5, and there are 2 types of nicotine receptor, nicotine N or nicotine M. N stands for nerve type, M stands for muscle type. So we have 2 types of nicotine receptor, nicotinic nerve type, nicotinic muscle type. So we have total 7 receptors in acetylcholine pathway. So acetylcholine acts on 7 types of receptor, 5 muscarinic and 2 nicotine receptor. And please remember, all receptors are stimulatory type of receptor except M2 and M4. All muscarinic and all nicotine receptor are stimulatory type of receptor except M2 and M4 receptor. Now, in case of noradrenaline, please remember noradrenaline will act on 2 types of receptor, alpha and beta. Alpha receptor 2 types, alpha 1, alpha 2. Beta receptor 3 types, beta 1, beta 2, beta 3. Total 5 receptors, and please remember all receptors are stimulatory except alpha 2. So in acetylcholine system, 2 receptors are inhibitory, M2 and M4, but in sympathetic system 1 receptor is inhibitory, that is only alpha 2. After that, we discuss the locations of these receptors. Regarding acetylcholine receptor locations, that nicotine M receptor is always present on the surface of voluntary muscles. So all voluntary muscles are having this receptor, that is NM receptor. Nicotine N receptor is present at nerve and nerve junction. So we have double N over here, so we call it nerve and nerve junction. So nicotine N receptor is present at nerve and nerve junction, which can be present in ganglia of autonomic system and can be present in nucleus of central nervous system. So where we have the presence of this nerve and nerve junction, now we have some drugs which will act on the sympathetic and parasympathetic system. So we have 2 types of medicines which will act on both parasympathetic and sympathetic system. So the drugs which will act on parasympathetic system, we can call them cholinergic drugs and anticholinergic drugs. Similarly, the drugs of sympathetic system, we call them adrenergic drugs and anti-adrenergic drugs, right? So the drugs which are cholinergic are of 2 types, directly acting and indirectly acting. Similarly, in sympathetic system, the adrenergic drugs are of 2 types, directly acting and indirectly acting. In anticholinergic drugs are of 2 types, which are muscarinic blockers, non-specific muscarinic blocker and specific muscarinic blocker. Now anti-adrenergic drugs are of 2 types, can be alpha blocker, can be beta blocker. So this is a basic physiology, and we will just start the pharmacology of autonomic nervous system. So the first topic is cholinergic system. So here we have to discuss the 4 group of medicines: cholinergic, anticholinergic, adrenergic and anti-adrenergic drugs. So we started our talk discussion during our lecture regarding cholinergic drugs. So now these medicines are of 2 types. These medicines are of 2 types, directly acting and indirectly acting. Now directly acting medicines are those which will directly stimulate the receptors. That's why we call them directly acting. Here we discuss 2 medicines. Number 1 is known as bethanechol. Now bethanechol is a drug which is already having the word chol. The chol stands for, it will act like a acetylcholine. So bethanechol starts with B and this will act like a acetylcholine. So chol stands for medicine will act like acetylcholine, and medicine starts with the alphabet B. So this medicine will act on B, that is bladder, and stimulate the bladder. So we discussed that dumbbells means stimulation of bladder. So this medicine can stimulate the bladder. It's a drug of choice for atonic bladder, which is also known as overflow incontinence. Also known as overflow incontinence. Now we have one more drug, that is pilocarpine. Now pilocarpine is a drug. Now this medicine will make the pupil pinpoint. So medicine is directly acting medicine. This medicine will make the pupil pinpoint. So if you look at the pilocarpine name, even this pilocarpine name, if you go back, COLI. So this will give you the feeling that it's a choline. So COLI is a choline. So it will act like a acetylcholine. So pilocarpine will also act like acetylcholine, and its name starts with PI. PI stands for, this will make the pupil pinpoint. So PI stands for pinpoint pupil. So this medicine will make the pupil pinpoint, that is meiosis, and because of meiosis, this medicine will cause widening of iridocorneal angle, and we use this medicine as a first line drug for angle closure glaucoma. We use this medicine as a first line drug for angle closure glaucoma, and whenever we give pilocarpine, this medicine can lead to 4 important side effects. So this medicine will cause pain in the eyes. This medicine will cause punctum blockage. This medicine will make the punctum blocked. Medicine will cause pain in the eyes. This medicine will make the pupil pinpoint, and because of pinpoint pupil, patient cannot see the things clearly. And number 4, this medicine will also cause peripheral retinal detachment. The 4th side effect is this medicine will cause peripheral retinal detachment. So these are the directly acting medicines which we discussed. After that, we started with indirectly acting medicines. Now, indirectly acting medicines are not directly stimulating the receptor. So these medicines will inhibit the acetylcholine esterase enzyme. Acetylcholine is metabolized by acetylcholine esterase enzyme. So if I block acetylcholine esterase enzyme, acetylcholine level will increase. And if this acetylcholine level will increase, this is going to stimulate the receptor. So if you inhibit acetylcholine esterase, acetylcholine will increase and now it will act on the receptor. And these indirectly acting medicines are of two types. These medicines can be reversible inhibitor of acetylcholine esterase or can be irreversible inhibitor of this acetylcholine esterase. Now the drugs which are irreversible inhibitors, these medicines will form covalent bond with this acetylcholine esterase enzyme, and this process of covalent bond formation is also known as aging. So aging is the word which we use when the medicine will form covalent bond with the enzyme and the enzyme is blocked forever. Medicines are poisons for human being and the drugs names are organophosphates and carbamates. So organophosphates and carbamates, which are generally used as insecticides and pesticides. Now these drugs, when consumed by patient either by mistake or in a purpose of committing the suicide, then patient will develop OP poisoning and carbamate poisoning. And when patient develop this OP poisoning and carbamate poisoning, patient acetylcholine esterase enzyme is permanently blocked and that will cause excess of acetylcholine in the patient body. And this acetylcholine will lead to the same symptoms like we discussed already, dumbbells. So acetylcholine will lead to same symptoms as dumbbells, which are responsible for death in a patient of OP poisoning and carbamate poisoning. Now here we have to give an antidote. The antidote is atropine. So the name of the antidote is atropine, which is blocker of muscarinic receptor. That OP poisoning, carbamate poisoning will lead to excess of acetylcholine that will act on muscarinic receptor and can lead to dumbbells as a symptoms. So if I block this muscarinic receptor by atropine, I can treat OP poisoning and carbamate poisoning. So it is the antidote of choice, drug of choice for OP poisoning, carbamate poisoning. But we have one more group of medicine, oxime, which starts with alphabet O, and these medicines are given only for OP poisoning. So oximes are given only for OP poisoning because in OP poisoning, the anionic site of the enzyme is free. That enzyme has two active sites, anionic site and ecstric site. So in OP poisoning, this anionic site is free, ecstric site is occupied, and that's why oximes which required anionic site for their action will bind to that anionic site and can remove organophosphate from there. So oximes can remove organophosphate from the ecstric site after binding to the anionic site and can lead to enzyme reactivation. What is the basic purpose of oxime? Oximes will make the enzyme reactivated. So the enzyme is again reactivated. The acetylcholine esterase enzyme we are talking about. So this enzyme is again reactivated and patient recovery phenomena will be very fast. Now we have some drugs. So this is all about irreversible drugs which are poisons for human being. Oximes, medicines are carbamates as well as organophosphate. Now after this irreversible drugs, we have some reversible drugs also. So we have two types of enzyme inhibitor, reversible and irreversible. Now reversible enzyme inhibitors can be of two types. Now these medicines can be tertiary, can be quaternary. Now tertiary acetylcholine esterase inhibitors can cross the blood-brain barrier and they can act on CNS, and quaternary drugs cannot cross the blood-brain barrier because of their structure and they cannot act on CNS. Now tertiary medicines that will act on CNS, we can divide these medicines in two groups. The one drug, that is donepezil, is given to improve your memory. So when you give donepezil will increase the acetylcholine level in your CNS. By inhibiting acetylcholine esterase enzyme, this will increase the level of acetylcholine in your CNS, and now this acetylcholine will act on your memory center, stimulate the memory center with the help of the nicotine receptor, and given for the treatment of Alzheimer's disease as a drug of choice. So donepezil is a drug of choice for Alzheimer's disease, given to improve the patient function memory. Right? Brain function is improved, memory is improved by giving donepezil given for Alzheimer's disease. We have one more drug that will act on CNS. The medicine name is physostigmine. So physostigmine is one more drug which will act in periphery as well as act in CNS. So we have a poisoning known as atropine poisoning. In OP poisoning, that atropine is muscarinic blocker. Atropine is an anticholinergic drug. So if a patient suffer from anticholinergic drug, we have to give a cholinergic drugs. And right now we are discussing all these medicines as cholinergic drug. So physostigmine is a cholinergic drug which is used as a drug of choice or antidote of choice for atropine poisoning, which is also known as datura poisoning or belladonna poisoning. Now this is all about tertiary medicines. We have some quaternary medicines also which will not act on CNS. Now these medicines are mainly given to improve the muscle strength. So whenever patient muscles are weak, patient wants to improve the muscle strength. Now we prefer to use quaternary medicines because quaternary medicines will increase the level of acetylcholine, and this acetylcholine will act on nicotine M type of receptor and will also act on muscarinic receptor, and by acting on nicotine M receptor or muscarinic receptor, this can improve the muscle strength or make the muscle contract. So this will make the muscle contract. So muscarinic receptor will contract the smooth muscle, and nicotine muscle type of receptor NM receptor will contract the voluntary muscle. So NM receptor will contract the voluntary muscle and muscarinic receptor will contract the involuntary muscle. Now we have three medicines which belong to this class. One is known as pyridostigmine, second is known as edrophonium, the third is known as neostigmine. So we have three medicines: pyridostigmine, edrophonium, neostigmine. Now pyridostigmine is a drug that is given to improve muscle strength in myasthenia gravis. It's a drug of choice for myasthenia gravis. Now edrophonium is a drug. Edrophonium is a medicine which is a very short acting medicine, and because of its short action, this medicine cannot be given for the treatment of any disease because patient compliance will not be there. So edrophonium is a drug that we use for diagnosis of myasthenia gravis, not for the treatment. So pyridostigmine we use for treatment, edrophonium we use for diagnosis of myasthenia gravis. Now we have a drug neostigmine. Now neostigmine is a drug which has a unique action. It's a fast onset of action. And because of this fast onset of action of this medicine neostigmine, this is used to regain the muscle strength. Neostigmine is a drug that is used to regain the muscle strength in those cases where there is an emergency. So during the time of emergency, we use neostigmine as a drug which has fast onset of action. So the medicine is drug of choice for cobra bite. This medicine is also given for skeletal muscle relaxant reversal. So whenever you have to reverse the effect of skeletal muscle relaxant after surgery, neostigmine is preferred medicine. Neostigmine is also drug of choice for cobra bite, and this is also given for post-operative retention of urine. Medicine is also given for post-operative retention of urine as well as paralytic ileus. Right? Now, whenever we give pyridostigmine or neostigmine for the treatment of myasthenia gravis, pyridostigmine is given for myasthenia gravis, neostigmine is given for cobra bite. It is given for the treatment of cobra bite. So when we use this medicine for myasthenia gravis and cobra bite, we use this medicine along with low dose of atropine. We always use this medicine along with low dose of atropine. Right? So pyridostigmine given for myasthenia gravis and neostigmine is given for cobra bite. For these two conditions, these medicines are given along with low dose of atropine to avoid the muscarinic side effect. So cobra bite and myasthenia gravis, atropine is used in a low dose to prevent the muscarinic side effect of neostigmine and pyridostigmine. Right? After that, we have the anticholinergic drugs. Now, the anticholinergic drugs are the drugs which will do actions which are just opposite to dumbbells. That acetylcholine will result in actions which are known as dumbbells. Now, anticholinergic drugs are opposite to cholinergic drugs. These medicines will do the action which is just opposite to dumbbells. Now, opposite of D is constipation. So, sympathetic system will also act opposite to parasympathetic system, and anticholinergic drugs will also act opposite to parasympathetic system. Right? Now, D opposite, that D stands for diarrhea. Now, D opposite is constipation, and because these medicines can reduce the peristalsis, these medicines are given for the treatment of diarrhea, particularly non-infective diarrhea. So drugs are given for non-infective diarrhea. The drug name is atropine. So in this class of drugs, anticholinergic class, atropine is a drug which is a second drug of choice for non-infective diarrhea. So non-infective diarrhea, atropine is second drug of choice, but the MCQ will come, what is a drug of choice? The answer you have to mark is loperamide. So loperamide is a medicine that is drug of choice, but atropine is marked as a second drug of choice for that condition. Now, in this mnemonic of dumbbells, U stands for retention of urine. So anticholinergic drugs can also cause relaxation of bladder and can result in retention of urine. And because these medicines can cause retention of urine, these medicines are drug of choice for overactive bladder, which is also known as urge incontinence. So medicines are drug of choice for urge incontinence, also known as overactive bladder, because medicines will relax the bladder. The drug which we use is known as oxybutynin. So oxybutynin is a drug that is given to relax the bladder and given for the treatment of urge incontinence. Now from here we can find out one contraindication of anticholinergic drug, which is quite important for your exam, because anticholinergic drugs can cause retention of urine, can relax the bladder, can cause retention of urine. So if a patient is already suffering from retention of urine, then these anticholinergic drugs are contraindicated. So if the patient bladder is overactive, medicines are drug of choice, but if the patient suffering from retention of urine, medicines are contraindicated. Now third is medicines can cause mydriasis and cycloplasia. So in the mnemonic of dumbbells, M opposite is mydriasis and cycloplasia. And because of this reason, these medicines will cause widening of pupil. So pupil is wide, and when the pupil is wide, the angle is closed. So widening of pupil will cause closure of peripheral angle. So widening of pupil, that is mydriasis, will cause closure of peripheral angle. So these medicines should not be given. These medicines should not be given to a patient who is a known case of glaucoma. So any patient who is a known case of angle closure glaucoma, medicines are contraindicated. So any patient who is a known case of glaucoma, drugs are contraindicated. There are 4 medicines which are used as a mydriatic and cycloplegic, and you have to remember the sequence of the drugs from most efficient to least efficient medicine, from the longest mydriatic to shortest mydriatic, and the sequence is atropine followed by home atropine, then we have cyclopentolate, and the fourth we have tropicamide. Now out of these 4 drugs, atropine and homatropine are 2 medicines which are strong cycloplegic. So these medicines are strong cycloplegic. These medicines are strong cycloplegic drugs, plus these medicines are long acting mydriatics. So they are the strong cycloplegic plus they are the long acting mydriatic drug, and because they are the strong cycloplegic, we use these medicines for refractive error in children, checking the refractive error in children, and because they are the long mydriatics, we use these medicines for the treatment of eye disease like amblyopia and anterior uveitis. So amblyopia and anterior uveitis are 2 conditions where we required mydriasis for long time. Now if we talk about other 2 medicines, that is cyclopentolate and tropicamide. So cyclopentolate, tropicamide are the weak cycloplegic drug. Mostly we use in refractive error of adult where the accommodation is already weak. We use cyclopentolate and tropicamide for that. Now these medicines are also short mydriatic, and because these medicines are short mydriatic medicine, these medicines are mainly given for eye examination and cataract surgery. So during cataract surgery and eye examination, we use cyclopentolate and tropicamide, but for amblyopia, anterior uveitis, we use long-acting mydriatics like atropine and homatropine. Now in the mnemonic of dumbbells, B stands for bronchodilation. So opposite of dumbbells mein B stands for bronchodilation. And so anticholinergic drugs will cause bronchodilation, and because these medicines can cause bronchodilation, medicines are given for bronchial asthma and COPD. So anticholinergic drugs are given for bronchial asthma and COPD. We have 2 types of medicines which are given by inhalational route. So these drugs are given by inhalational route. Medicines names are SAMA and LAMA. Short-acting muscarinic antagonist and long-acting muscarinic antagonist. So medicines are bronchodilators, and these bronchodilators are short-acting or long-acting. So we call them short-acting muscarinic antagonist, or we also call them long-acting muscarinic antagonist. So short-acting muscarinic antagonist is a drug that is ipratropium bromide, and when we give ipratropium by inhalational route, it is mainly given for acute bronchial asthma and COPD. So SAMA drugs have fast onset of action. So these medicines are given for acute bronchial asthma and COPD. Drug is ipratropium, and when we give this medicine by inhalational route, the medicine side effect is dry mouth. So drug side effect is dry mouth. So if we talk about long-acting muscarinic antagonist, these medicines have slow onset of action, and because of slow onset of action, the drug like tiotropium bromide. The drug is tiotropium bromide. This is given for maintenance treatment of COPD and bronchial asthma, but this is overall drug of choice for maintenance treatment of COPD. Now, whenever these drugs are asked in your exam, you have to just find out a word atropine in their name. So if you find out the word atropine in their name, then you can easily find out that these medicines are anticholinergic and they are the bronchodilators. So ipratropium, tiotropium are having the word tropine in their name. So you can find out these words are atropine analog, and atropine is a classical drug which is an anticholinergic drug. Now next, moving on to the next group of medicine. In mnemonic of dumbbells, B stands for bradycardia, and here the opposite of B is tachycardia and increased conduction in the heart. So atropine is a drug which can cause tachycardia, and atropine can increase conduction in the heart. So atropine is a drug that is considered as drug of choice for sinus bradycardia as well as heart block. In the mnemonic of dumbbells, there is LSS, that is increased secretion of glands. So we have anticholinergic drugs which can reduce secretions of glands. So anticholinergics can reduce the secretion of glands, and we can use these medicines as a pre-anesthetic drugs. So medicines which are used as pre-anesthetic drugs, we have two medicines over here. One is known as atropine, second is known as glycopyrrolate. And the basic difference between two medicine is atropine will cross blood-brain barrier and act on CNS, but glycopyrrolate cannot cross blood-brain barrier and will not act on CNS. The basic advantage of glycopyrrolate is this. So atropine has CNS side effect, but glycopyrrolate, which cannot act on CNS, will not produce CNS side effect. It's the advantage of glycopyrrolate. Now we have a drug which can reduce the acid secretion. So just like other secretion, acid secretion is also reduced. So the drug name is pyrinzipine. Pyrinzipine is a medicine which is given for the treatment of peptic ulcer disease by blocking the muscarinic 1 receptor. So we discussed already muscarinic 1 receptor present on acid secreting cells. So by blocking this muscarinic 1 receptor, medicine like pyrinzipine is given for the treatment of peptic ulcer disease. And you can remember like this way, pyri stands for parietal cell. So this medicine will act on parietal cell of the kidney, parietal cell of the GIT, and this will produce the zip on that parietal cell. So parietal cell will be zipped in. So you'll put a zip on the parietal cell. Parietal cell will not secrete the acid, and we use this medicine for peptic ulcer disease. Now the medicines which act on central nervous system, medicines block the effect of acetylcholine in central nervous system, and when we block the effect of acetylcholine on central nervous system, we can treat the tremors. Acetylcholine by acting on muscarinic 1 receptor can lead to tremors. So if I block this muscarinic 1, tremors will be controlled. The drug name is benzhexol, and this benzhexol is given for the treatment of tremors. So medicines which is given for the treatment of tremors is benzhexol. So benzhexol is a drug which is having the word benz, and this medicine is given for the treatment of drug-induced Parkinsonism as a drug of choice. So drug-induced Parkinsonism, drug of choice is benzhexol. If you have the Mercedes-Benz with you, then you need not to think about the parking. So if you have Mercedes-Benz, need not to think about the parking. So parking problem will not occur if you have the Mercedes-Benz. Now by blocking the acetylcholine in CNS, we can also reduce the patient cognition. So patient cognition will go down, and patient cannot keep the things in his mind, right? So patient cannot hide the things, patient will speak out the truth. And hyoscine is a medicine here. Hyoscine is a medicine over here which is used for narco analysis. So during the narco analysis, we use this medicine to know the truth which is present in the patient mind. Plus hyoscine, by blocking this acetylcholine in CNS, it can also treat the motion sickness. So the signals which are going in the brain can lead to motion sickness. So this medicine, by blocking this acetylcholine signals in the brain, given for the treatment of motion sickness as a drug of choice. And this medicine is also used in the form of skin patch. So for the treatment of motion sickness, we can use this medicine in the form of skin patch, and we will apply this skin patch behind the pinna. So this is all about cholinergic drugs as well as anticholinergic drugs. So in anticholinergic drugs, you have to just remember opposite to dumbbells. So if you know the opposite to dumbbells, then the drug names automatically comes in your mind. Like for constipation, it's atropine. For retention of urine, it's oxybutynine. For mydriasis, 4 drugs: atropine, hyoscine, and atropine, homatropine, and cyclopentolate. Bronchodilators, ipratropium, tiotropium. Medicines given for bradycardia, again atropine. LSS, glandular secretions are reduced, so glycopyrrolate is used as a pre-anesthetic drug, right? Pyrinzipine can reduce the acid secretion. So anticholinergic drugs, just remember the opposite of dumbbells. And for cholinergic drugs, you have to just remember the dumbbells. So these medicines will lead to dumbbells as a effect. 2 types of medicines, directly acting, indirectly acting. Directly acting, bethanycol, pilocarpine. Indirectly acting, reversible, irreversible. Irreversible are organophosphate and carbamates. Reversible, 2 types, medicines act on CNS like donepezil, physostigmine. Quaternary drugs are mainly given to improve the muscle strength like pyridostigmine, edrophonium and neostigmine. So this is all about parasympathetic system, that is cholinergic and anticholinergic drugs. Now after that we have the third system, that is adrenergic drugs. Third topic, that is adrenergic drugs in autonomic system. Now just like cholinergic drugs, we have the adrenergic drugs, directly acting and indirectly acting. Now directly acting medicines are those which will directly act on the receptor, and indirectly acting are those which are inhibitor of noradrenaline metabolism. So these medicines are inhibitor of noradrenaline metabolism. In cholinergic drugs, drugs for inhibiting the acetylcholine esterase enzyme, and here the medicines will inhibit the reuptake phenomena. So we discussed already that noradrenaline is metabolized by MAO enzyme, and how this noradrenaline will reach up till MAO enzyme by reuptake phenomena. So medicines will block this reuptake phenomena and therefore increase the level of noradrenaline. Now this noradrenaline will act on the receptor. This is an indirect action. Only two medicines which are indirectly acting. One is known as methylphenidate, the second is known as modafinil. So indirectly acting medicines are only two, methylphenidate and modafinil, and we made the mnemonics like this way, that methylphenidate is drug of choice for ADHD. Methylphenidate is drug of choice for ADHD. So we made the mnemonic, if you want to go on date with someone, give attention to that person. So if you want to go on date, give attention to that person. So methylphenidate is drug of choice for ADHD, that is attention deficit hyperactive disorder. And for modafinil, we made the mnemonic that modafinil is drug of choice for narcolepsy. Narcolepsy is excessive sleepiness or excessive drowsiness. So phenyl means final exam. So we made the mnemonic, before your final exam, you have to reduce the sleep. Before the final exam, you have to reduce the sleep. So take modafinil. So take modafinil before the final exam. So phenyl stands for final. So before the final exam, take the modafinil to reduce the sleeping time. So these are the indirectly acting medicines, two indirectly acting medicines. Now after that we discuss about directly acting medicines. Now directly acting medicines can be of two types, can be catecholamine, can be non-catecholamine. We have two types of medicines, catecholamine and non-catecholamine drugs, right? Now if we talk about catecholamine medicines first, now there are 6 catecholamine, and out of those 6 catecholamine, 3 are natural, 3 are artificial. Now three natural catecholamines are dopamine. So dopamine is natural catecholamine, second is adrenaline, third is noradrenaline. So dopamine, adrenaline and noradrenaline are 3 natural catecholamine, and there are 3 synthetic catecholamine, that is dobutamine, isoprenaline and phenoldopam. So dobutamine, isoprenaline, phenoldopam are 3 artificial catecholamine. So let's talk about the medicine which is natural catecholamine. So natural catecholamine is dopamine, and this dopamine is given in 3 type of dosing schedule: less than 2 dose, 2 to 10 dose and more than 10 dose. So the dose of this medicine is given in microgram per kg per minute. So this dose of the dopamine is less than 2 microgram per kg per minute, 2 to 10 dose, more than 10 dose. So we made the mnemonic that dopamine will act on 3 types of receptor in a sequence, and to remember this sequence we have to just remember ABCD. We have to just remember this ABCD, and this ABCD we have to remember in opposite direction. We have to remember this ABCD in opposite direction. First of all, D1. Now there is no receptor starts with C, so just remember C is for catecholamine. We are discussing the catecholamine. So first is D1, then we have beta 1, then we have alpha 1. So in less than 2 dose, this medicine will only act on D1 receptor. In dose 2 to 10, it will act on D1 and beta 1. And in dose more than 10, it will act on all 3 receptor, D1, beta 1 as well as alpha 1. So less than 2, only D1, 2 to 10, D1 and beta 1 both. And more than 10, it will act on D1, beta 1 as well as alpha 1. Now in dose between 2 to 10, in a dose between 2 to 10, this medicine is considered as drug of choice for cardiogenic shock with oliguria. So in a dose between 2 to 10, it will act on D1 receptor. So by acting on D1 receptor, this medicine can increase the GFR, and by acting on beta 1 receptor, this medicine can increase the cardiac output. So by acting on D1, it can increase the GFR, and by acting on beta 1 receptor, it can increase the cardiac output. So this medicine is considered as cardiogenic shock, drug of choice for cardiogenic shock with oliguria in a dose 2 to 10 microgram per kg per minute. And this is the important MCQ for your exam. Now in a dose more than 10, this medicine will act on 3 receptor D1, beta 1 as well as alpha 1, and in this dose this medicine by acting on alpha 1 receptor will increase the blood pressure. By acting on beta 1 receptor, it can increase the cardiac output, and by acting on D1 receptor, this medicine can increase the GFR. So by acting on D1, GFR is increased, so kidney is saved. By acting on beta 1, cardiac output is increased, so all organs will get the blood supply. Plus all organs will get the blood supply with a good pressure, because blood pressure is also increased. So it's a second drug of choice. This medicine is used as a second drug of choice for almost all type of shock except anaphylactic shock. So for anaphylactic shock, we use adrenaline as a drug of choice, but this is not a second drug of choice for that. So dopamine is second drug of choice for almost all type of shock, but not for anaphylactic shock, and it's a drug of choice for cardiogenic shock with oliguria. Now we have the next medicine, adrenaline. Adrenaline starts with alphabet A. So adrenaline is a drug which starts with alphabet A. So this medicine will act on both alpha and all beta receptor. So adrenaline starts with A. This will act on all alpha and all beta receptor. This will act on all alpha and all beta receptor, including the beta 2 receptor. This will also act on beta 2 receptor. Now when this adrenaline is given, this is drug of choice for anaphylactic shock, as well as it's a drug of choice for cardiac arrest. Now for anaphylactic shock, we have to use its preparation. We call it 1:1000 preparation. So for anaphylactic shock, we use in a preparation 1:1000 preparation. The dose of the medicine is 0.5 milligram, and the route of administration is intramuscular route. Right? For cardiac arrest, the concentration of drug is 1:10,000, but the dose is now doubled. For cardiac arrest, the dose is double than the anaphylactic shock dose. Anaphylactic shock dose 0.5 milligram, cardiac arrest dose 1 milligram. In anaphylactic shock, the route is intramuscular, and here in cardiac arrest, the route is intravenous. And if the intravenous route is not possible, you will give medicine by intraosseous route. Now there is one animal experiment in relation to adrenaline, that is known as reversal of Dale, vasomotor reversal of Dale. So what happens in vasomotor reversal of Dale? First of all, we give alpha blocker to animal, and after giving alpha blocker to animal, we give high dose of adrenaline. After giving alpha blocker to animal, we give high dose of adrenaline, and that will lead to fall in blood pressure. So why, they will ask you this question in reversal of Dale, why there is a fall in blood pressure? So fall in blood pressure is due to beta 2 receptor, and from this experiment reversal of Dale, we discovered beta 2 receptor. So reversal of Dale is associated with discovery of beta 2 receptor. So it is useful. The adrenaline is used during reversal of Dale to discover the beta 2 receptor. Now we have a third catecholamine. The drug name is noradrenaline. The drug name is noradrenaline or norepinephrine. Now noradrenaline starts with word nor. So this medicine is non-agonist of beta 2. So this medicine is not agonist of beta 2. Otherwise this medicine is agonist of all. So just like adrenaline, it is agonist of all receptor, all alpha, all beta. Just like adrenaline, it is agonist of all alpha, all beta, but it is non-agonist of beta 2. Now by acting on alpha 1 receptor, this medicine can increase the blood pressure, and by acting on beta receptor, this can stimulate the heart and increase the cardiac output. So this can increase the blood pressure, increase the cardiac output. So it is given as a drug of choice for all type of shock. This is given as drug of choice for all type of shock except for two type of shock. One is cardiogenic shock with oliguria. So cardiogenic shock with oliguria, dopamine is a drug of choice. For anaphylactic shock, adrenaline is a drug of choice. Otherwise, noradrenaline is drug of choice for almost all type of shock, which can be hypovolemic shock, septic shock, cardiogenic shock, neurogenic shock, spinal shock, hypotensive shock, hypovolemic shock. Any kind of shock is there. Noradrenaline is a drug of choice. But for cardiogenic shock with oliguria and for anaphylactic shock, we use other medicines. Now we have some artificial catecholamine, that is dobutamine. Now dobutamine is a drug which is beta 1 receptor stimulator. We discussed that dobutamine is a drug which is having the word buta in its name. And because of the buta in its name, this medicine will only act on beta 1 receptor. So this medicine has two indication. It is given to increase the cardiac output and given for cardiogenic shock as one of the drug. Second, it is also most commonly used medicine. It is also most commonly used medicine during stress echocardiography. Now, other two catecholamines are not very important for your exam. One is isoprenaline. So, isoprenaline is a drug that will act on all beta receptor, beta 1, beta 2, beta 3. Second is phenoldopam. Phenoldopam is a drug that will act on dopamine 1 receptor. And by acting on dopamine 1 receptor, this medicine can dilate two vessels of the body. One is the kidney vessels, second is the mesentery vessel. Now, when this medicine dilates the kidney vessel, this medicine can increase the GFR. And when this medicine will dilate the mesentery vessels, this medicine can cause fall in blood pressure. So we use this medicine for the treatment of hypertensive crisis with oliguria. That is all about catecholamine. Now we have one more group of medicine, that is non-catecholamine drugs. So adrenergic drugs, two types, directly acting, indirectly acting. In indirectly acting medicine, we discuss two drugs, methylphenidate, drug of choice for ADHD, modafinil, drug of choice for narcolepsy. In catecholamine, we discuss three natural catecholamine, dopamine, adrenaline and noradrenaline. And three artificial catecholamine, that is dobutamine, isoprenaline and phenoldopam, which are comparatively less important for your exam. Now we are moving on to the non-catecholamine drugs. Now these medicines which are non-catecholamine, here we have discussed three group of medicines. The first group of medicine is the drugs which will act on alpha-1 receptor. Medicines which will act on alpha-1 receptor. Here we discuss two medicines. Number one is phenylephrine. Now phenylephrine and other are oxymetazoline and xylometazoline. So oxymetazoline and xylometazoline are not important for your exam. These medicines are used in the form of nasal drops as a decongestant. So oxymetazoline, xylometazoline comes with the brand name of Otrivin, you people must be knowing, used as a nasal spray as a decongestant. Now we have other alpha-1 agonist, the drug is phenylephrine. Now phenylephrine is a unique medicine which will cause mydriasis without cycloplagia. So this drug will act on alpha-1 receptor, contract the radial muscle of iris, and by contracting the radial muscle of iris, this medicine will cause mydriasis, but this medicine has no effect on ciliary muscle of lens, so there is no cycloplagia. So drug will cause mydriasis without cycloplagia. The drug name is phenylephrine. Second, this medicine is also used as a drug of choice for hypertension. So this medicine, by acting on alpha-1 receptor, contract the blood vessels. When the blood vessels are contracted, the BP is raised. So this medicine is drug of choice for hypertension that is seen after spinal anesthesia or after LSCS surgery. So after obstetric surgery or LSCS surgery, the BP which is fallen, the drug of choice for that reduced blood pressure is phenylephrine. Right? Now we have the medicines which are alpha-2 agonist. The drugs which are alpha-2 receptor agonist. So we discussed already that alpha-2 receptor has two locations in the body, that is 2C. One is central nervous system, second is the ciliary body of eye. And this receptor is a type of inhibitory receptor. Alpha-2 receptor is a type of inhibitory receptor. And because this is a type of inhibitory receptor, this is going to inhibit the CNS as well as going to inhibit the ciliary body of eye. So the medicines which are alpha-2 receptor agonist inhibit central nervous system, and by inhibiting central nervous system, they can inhibit the vasomotor center. And by inhibiting the vasomotor center, we can use this medicine for the treatment of hypertension. So we have two medicines. One is known as clonidine, second is known as alpha-methyl-dopa. So clonidine and alpha-methyl-dopa are two medicines which are given for PIH. Clonidine and alpha-methyl-dopa are given for PIH, and out of these two, methyl-dopa is less commonly used nowadays because of two important side effects. One is known as SLE-like reaction, second is known as autoimmune hemolytic anemia. Alpha-methyl-dopa can induce antibodies, and because of antibody induction, this medicine can cause SLE and can result in autoimmune hemolytic anemia. So the Coombs test comes out to be positive. So the Coombs test comes out to be positive because of this antibody induction in the plasma. Now we have the medicines that will act on ciliary body of eye, inhibit the ciliary body of eye, reduce the aqueous humor synthesis. The drug names are apraclonidine and brimonidine. So apraclonidine and brimonidine are two medicines which we use to reduce the aqueous humor synthesis. Now these medicines are given for the treatment of glaucoma, but the important side effect of this medicine is these drugs will cause retraction of eyelid. Medicines can cause retraction of eyelid and contraindicated in children and neonates. So these drugs can cause retraction of eyelid and contraindicated in children and neonates because medicines can cause respiratory suppression. Medicine can cause respiratory suppression, so contraindicated in children and neonates. Now we have the last group of non-catecholamine, that is beta 2 agonist. Now beta 2 agonists are again of two types. So if you look at this topic, non-catecholamine topic, everywhere we have two classes. Like if we first discuss alpha 1 agonist two types. One is phenylephrine and second is nasal spray oxymetazoline, xylometazoline. Second, we discussed alpha 2 agonist, again two types. Medicines which act on CNS, clonidine, alpha methyl dopa, given for hypertension. Medicines which are given for glaucoma in the form of eye drop, apraclonidine, brimonidine. Now again we have beta 2 agonists which are of two types, bronchodilators and tocolytics. Now tocolytics medicines are those which will relax the uterus, and these medicines are given for preterm labor. So tocolytics will relax the uterus, given for preterm labor. The drugs are ritodrine and isoxaprine. So isoxaprine and ritodrine are two medicines which are given for preterm labor. Right? And we have some bronchodilators like SABA and LABA, and you know the names of the SABA and LABA already. The SABA drugs are those which are having the word buta in their name, like salbutamol and terbutaline, and we have the drugs like LABA which have metro word in their name. So the drugs which have metro word like salmetrol and formoterol. So salbutamol, terbutaline are SABA and salmetrol and formoterol are LABA. Now these medicines are given for bronchial asthma and COPD, and during our lecture we discussed that salbutamol has 6 side effects where the 3 starts with T and 3 starts with H. So this medicine can cause tremors, this medicine can cause tachycardia, this medicine can also cause tolerance. So tremors, tachycardia and tolerance. Other side effects are like hypotension. These medicines can cause hypokalemia and can result in hyperglycemia as a side effect. Tremors, tachycardia, tolerance. Second is hypotension, hypokalemia and hyperglycemia, 3 side effects caused by salbutamol. So this is all about adrenergic drugs which we discussed during our lecture. Now after this adrenergic drugs, we discuss the anti-adrenergic drugs. So the medicines which are anti-adrenergic drugs, these medicines are of two types. Medicines can be alpha blocker, can be beta blocker. So we have two types of medicines, alpha blocker, beta blocker. In alpha blockers, 4 medicines basically. 3 medicines starts with alphabet P. 3 medicines start with alphabet P and they are given as a drug of choice for some hypertensive crisis. For example, we discussed prazosin. So prazosin is drug of choice for hypertensive crisis that is associated with scorpion bite. Second, phentolamine, and phentolamine is drug of choice for hypertensive crisis that is seen with cheese reaction. Cheese reaction is when we consume tyramine containing food with MAO inhibitor. So cheese reaction is when we consume tyramine containing food along with MAO inhibitor. So we use phentolamine for that. That Fenta and cheese are consumed together. So Fenta and cheese should always be consumed together. So Fenta is the name of a soft drink. So Fenta and cheese should always be consumed together. So phentolamine, drug of choice for cheese reaction. Prazosin, drug of choice for scorpion sting. Third drug, phenoxybenzamine. Now phenoxybenzamine is irreversible blocker of alpha receptor. This is a unique medicine which is irreversible blocker of alpha receptor by making a covalent bond with this alpha receptor. So the drug will make covalent bond with alpha receptor. The drug is phenoxybenzamine and we use this medicine for the treatment of pheochromocytoma. So this drug is having the word ban. So this medicine will ban the alpha receptor. So medicine will ban the alpha receptor by blocking it irreversibly. So drug will block alpha receptor irreversibly. So it will ban the alpha receptor and we use this medicine to ban the tumor. So if you block the alpha receptor irreversibly, then only you can treat the tumor. So it's a drug of choice for hypertensive crisis associated with pheochromocytoma. So two drugs we discussed for pheochromocytoma. One is this phenoxybenzamine, that is a drug of choice. And the second, if you guys remember, it's a metyrosine. So metyrosine is one more drug that we use for the treatment of pheochromocytoma, and that is tyrosine hydroxylase blocker. That's a rate limiting enzyme in the noradrenaline synthesis pathway. Now the second drug, now in alpha blocker, apart from three medicine which start with alphabet P, we have one more drug, that is tamsulosin. Now tamsulosin and silodosin are two medicines which are blocker of alpha 1A receptor. These medicines are specific blocker of alpha 1A receptor, and these medicines are given for the treatment of BPH as a drug of choice. So medicines are drug of choice for BPH, and we made a mnemonic of tamsulosin. That tamsulosin starts with our word tamso. Tamso means tamso. Tamso means tamas. It's a fire. It's a ag, right? So it's a fire. It's a heat of the ag, tamso or tamas. So medicine side effect is fire. So this medicine can cause floppy iris syndrome. The drug can cause floppy iris syndrome and can result in retrograde ejaculation. So drug can cause retrograde ejaculation and floppy iris syndrome as a side effect. So tamsulosin, which is the tamso or tamas or the ag or the fire, the mnemonic is fire. Fire means floppy iris syndrome and retrograde ejaculation. That is all about alpha blocker. So we finished alpha blocker in only 5 drugs. 3 medicines starts with P and 2 medicines which are specific alpha 1A blocker given for BPH. Now we have beta blockers. Now beta blockers, we have discussed that there are 3 generations of beta blocker. In beta blockers we discussed we have 3 generations of beta blocker. Generation 1 beta blockers. Generation 1 beta blockers are non-selective beta blockers. They block beta 1 and beta 2 receptor both. But generation 2 medicines are selective beta blockers. They block only beta 1 receptor. And generation 3 beta blockers are very special beta blockers which will cause vasodilation. So there are some beta blockers which have vasodilator property. We have placed under group 3 or generation 3. So let's start with first generation 1 medicines. Now generation 1 beta blockers are the non-selective beta blockers. They block beta 1 as well as beta 2 receptor. That beta 2 receptor is present on the surface of all involuntary muscle and it will relax the smooth muscle. Beta 2 receptor normally relax the smooth muscle. Now if I block the beta 2 receptor, if I block the beta 2 receptor, smooth muscles will not be relaxed, rather smooth muscles will be contracted. So this generation 1 medicine contract the smooth muscle and causes vasoconstriction and bronchoconstriction. So 2 important side effects of generation 1 medicines are vasoconstriction and bronchoconstriction, and that is why these medicines are not indicated. These medicines are not useful for cardiovascular system indication. So if a patient is suffering from any cardiovascular problem because of the vasoconstriction, medicines are not useful. So because of vasoconstriction problem, medicines are not useful if the patient is suffering from any cardiovascular problem. Now on the basis of this vasoconstriction and bronchoconstriction, these medicines have some contraindication. Now because of bronchospasm, we cannot use this medicine for bronchial asthma and COPD. But because of vasoconstriction, I should not use this medicine to a patient of hypertensive crisis. I should not use this medicine to a patient who is suffering from peripheral vascular disease like Raynaud's disease. So any patient who is already suffering from Raynaud's disease, already there is a vasospasm, like in patients of angina, MI or peripheral vascular disease, medicines are contraindicated. Then what are the indications? So answer is these medicines are not given if the patient is having cardiovascular or the respiratory problem. The patient is having cardiovascular or respiratory problem, medicines are not indicated, but these medicines are indicated but if the patient is having some non-cardiovascular indication. For example, there is a drug propranolol. Now propranolol is a drug which will take CNS entry. So this medicine will take entry in CNS, and because this will take entry in CNS, this propranolol will take entry in CNS, and after taking entry in CNS, this medicine block the beta 1 receptor in CNS, and by blocking beta 1 receptor in CNS, it is considered as drug of choice for 3 CNS problem. One is performance anxiety. It's a drug of choice for performance anxiety. It is drug of choice for inner restlessness. It is drug of choice for inner restlessness, which is also known as akathisia. So inner restlessness, also known as akathisia. So it is a drug of choice for inner restlessness. Plus it is also drug of choice for essential tremors. So all these 3 actions, all these 3 diseases are due to the CNS involvement. So CNS is overactive. So we can block this CNS activity and we can treat performance anxiety, we can treat akathisia or restlessness, or we can treat essential tremors by blocking the CNS activity. So propranolol is a medicine which is a drug of choice for all these three. Now sometimes this vasoconstriction is required for us. So there are some conditions where vasodilation is a problem. So one is the migraine prophylaxis. So for migraine prophylaxis, propranolol is a drug of choice. So for migraine prophylaxis, propranolol is a drug of choice. So propranolol is a drug of choice for migraine prophylaxis, and these medicines are also drug of choice for prophylaxis of esophageal varices. And for esophageal varices we can use any of the generation 1 medicine, but we can use propranolol, nadolol or sotalol preferably. So sotalol, nadolol, these medicines are preferred. So propranolol, nadolol, sotalol are given for esophageal varices. Now apart from that, these medicines can block the action of ciliary body, and by blocking the action of ciliary body, these drugs can reduce the synthesis of aqueous humor. So aqueous humor synthesis will be reduced and medicines are given for glaucoma. The drug is timolol. Now timolol is a drug. This medicine is contraindicated in patients of bronchial asthma, because this is generation 1 medicine, and generation 1 medicines, by blocking the beta 2 receptor. By blocking the beta 2 receptor, generation 1 medicines can cause bronchospasm and vasoconstriction, so should not be given to a patient of bronchial asthma. Now we have generation 2 and generation 3 drugs. Now generation 2 medicines are the selective beta blockers. The names are BEAM. We discuss BEAM. BEAM stands for betoxolol, E stands for esmolol, A stands for atenolol, M stands for metoprolol. So betoxolol, esmolol, atenolol, metoprolol are generation 2 medicine. Now generation 3 medicines are vasodilators. Examples of these medicines are like labetalol. One more example is like carvedilol. So carvedilol, labetalol are two medicines which are generation 3 medicines. Now these medicines can directly suppress the heart by blocking the beta 1 receptor. So one of the location of beta 1 receptor is heart. So by blocking the heart, by blocking this beta 1 receptor, medicine can suppress the activity of heart and can lead to 3 important side effects or 4 important side effects. Medicine side effects are bradycardia, decrease in cardiac output, and decrease in cardiac conduction. So by blocking the activity of heart, medicines can cause bradycardia, decrease cardiac output, decrease conduction, and whenever cardiac output is reduced, medicines can also lead to hypotension as a side effect. On the basis of these side effects, we have 4 contraindication. Because medicines can reduce the heart rate, should not be given in bradycardia. Because medicines can reduce the cardiac output, we should not use it for acute CHF. Because medicines can reduce the conduction, I should not use the medicine for heart block. And because medicines can reduce the BP, I should not use in a patient who is already suffering from hypotension. Now, where we use the medicine? Now, these medicines are mainly given for cardiovascular indication. Like we discussed in generation 1 medicines are not given for cardiovascular indication. Generation 1 medicines are given for non-cardiovascular indication, but generation 2 and 3 medicines are mainly given for cardiovascular indication. So these drugs are given for almost all type of cardiovascular disease. Like medicines are given for hypertension, CHF, angina, myocardial infarction, arrhythmia, as well as given for HOCM. Right? So these medicines are given for hypertension, angina, MI, CHF, arrhythmia, as well as for HOCM. Now in hypertension, we have covered already that labetalol is a medicine. It is a drug of choice for PIH. Labetalol is a medicine that is a drug of choice for PIH. And in CHF patient, the medicines are given to prevent the cardiac remodeling. So beta blockers are given to prevent the cardiac remodeling and also to keep the heart rate low. So beta blockers are given to prevent the cardiac remodeling as well as given to keep the heart rate low, and carvedilol is a beta blocker which is best beta blocker for CHF patient. So carvedilol is the best beta blocker for CHF patient. And also these medicines are given for arrhythmia and they are useful for the treatment of supraventricular type of arrhythmia, and these medicines are drug of choice for sinus tachycardia. Generation 2 and 3 medicines are drug of choice for the treatment of sinus tachycardia. Now apart from that, these medicines block beta 1 receptor in ciliary body of eye, and by blocking beta 1 receptor in ciliary body of eye, medicines can reduce the aqueous humor synthesis. So we use this medicine for the treatment of glaucoma. The drug name is betoxolol. So in generation 1 we use timolol, We use timolol in generation 1, but in generation 2 and 3, we use betoxolol for the treatment of glaucoma. So that is all about anti-adrenergic drugs. Two type of anti-adrenergic drugs, alpha blocker, beta blocker. Alpha blockers are easy to memorize. Three medicines starts with P and one is tamsulosin. It's a drug of choice for BPH. Now beta blockers, generation 1, 2 and 3. So generation 1 are given for non-cardiovascular indication because of the two important side effects. One is bronchospasm, second is vasospasm. But generation 2 and 3 are mainly given for cardiovascular indication like hypertension, CHF, angina, MI or arrhythmia. That is all about adrenergic and anti-adrenergic drugs. Anti-glaucoma drugs. Now whenever we have to treat the glaucoma, in glaucoma patient the aqueous humor is very high. We know that aqueous humor or intraocular pressure is very high. So we can reduce this intraocular pressure by two methods. So we have some drugs which can increase the drainage. We have some drugs which can increase the drainage of aqueous humor, or we have some drugs which can reduce the synthesis of aqueous humor. Medicines which can increase the drainage of aqueous humor or the medicines which can reduce the synthesis of aqueous humor. So the drugs which can increase the drainage of aqueous humor, number one, the drug which can increase trabecular drainage is pilocarpine. It's a first line drug for angle closure glaucoma and four important side effects. Now we have a drug that will increase the uveoscleral drainage. So medicine that will increase the uveoscleral drainage, the drug name is latanoprost. Now latanoprost is a drug which is prostaglandin F2 alpha analog. So it is a prostaglandin F2 alpha analog, latanoprost. Now this medicine is overall drug of choice for maintenance treatment of glaucoma. So pilocarpine is given for angle closure glaucoma, acute attack mostly, but latanoprost is overall drug of choice for maintenance treatment of glaucoma, and the medicine side effect is like a pile. So in this mnemonic of pile, we discussed that this medicine can cause pigmentation of iris. This medicine can cause pigmentation of iris. This medicine can also cause inflammation in the eye. Medicine can increase the length of eyelashes, and this medicine can cause edema in macula. So pile is a mnemonic where P stands for pigmentation, I stands for inflammation, L stands for lengthening of eyelashes, E stands for edema, or one more mnemonic is clip where instead of E edema we remember cystoid macular edema. So drug will cause cystoid macular edema, drug will cause increased length of eyelashes, I stands for inflammation, P stands for pigmentation of iris. Now we have some drugs which can reduce the aqueous humor synthesis. Now these medicines are beta blocker. Like one of the important side effect of timolol and betoxolol is they can reduce the corneal sensation. We have drug like alpha-2 agonist, brimonidine and apraclonidine, that medicines can cause retraction of eyelid and should not be given to children and neonates. Now the drug is third group of medicine is carbonic anhydrase inhibitor. The mnemonic is ABCD, where A stands for acetazolamide, B stands for brinzolamide and D stands for dorzolamide. So A is for acetazolamide, B is for brinzolamide, C is for carbonic anhydrase inhibitor, D is for dorzolamide. Now out of these medicine, acetazolamide is given by IV or oral route. Acetazolamide is given by IV and oral route. It's a drug of choice for acute angle closure glaucoma. So acetazolamide, drug of choice for acute angle closure glaucoma, but brinzolamide and dorzolamide are given in the form of eye drops. So brinzolamide, dorzolamide given in the form of eye drop is a third group of anti-glaucoma drug which can reduce the aqueous humor synthesis. So medicines which can reduce the aqueous humor synthesis, one is beta blocker, second is alpha-2 agonist, third is carbonic anhydrase inhibitor, the fourth is mannitol. Now the mannitol is a drug which is always given by IV route, and this medicine is given for refractory cases of acute angle closure glaucoma. So mannitol is given for refractory cases of acute angle closure glaucoma. That is all about anti-glaucoma drugs, and the topic is autonomic system. So this topic is over. Next topic is respiratory system. So if we talk about this respiratory system, from this topic one MCQ will be asked, and mostly this topic question will be from bronchial asthma drugs. So drugs which we use for bronchial asthma, every year you get one MCQ. Now which drugs we use for bronchial asthma? For this you have to understand the physiology or the pathophysiology of this bronchial asthma. So whenever allergen takes entry in our body, IgE is activated, and this IgE will act on mast cell. So allergen has been inhaled by the patient. So allergen is entered in your bronchiole. Now this will activate the immunity or the inflammatory pathway. IgE is activated. Now when this IgE is activated, IgE will act on mast cell. And when this IgE will act on mast cell, the mast cell DNA is stimulated, and that will result in increased expression of an enzyme, that is lipoxygenase enzyme. So mast cell will increase the expression of lipoxygenase enzyme, that is known as LOX. Now this lipoxygenase enzyme will form the leukotrienes. Now later on, leukotrienes are released from the mast cells. Leukotrienes are released from the mast cells, and now these leukotrienes which are released from the mast cells will act on their receptor. We call it leukotriene receptor. Now when these leukotrienes will act on their receptor, this will result in inflammation of bronchioles, and bronchioles will go in spasm. This is your bronchial asthma, right? So allergen has taken entry, IgE is activated, mast cells are stimulated, that will result in increased lipoxygenase enzyme, that will form leukotrienes. Leukotrienes are released, leukotrienes will act on the receptor, will cause the inflammation of bronchioles with the help of its receptor and causes bronchoconstriction. Now we have the drug name is omalizumab. The drug name is omalizumab, the mnemonic of omalizumab, that there is a boy Om and the second is Ali. So the Om and the Ali are Hindu and Muslim, and they will fight together against the English people. So E stands for English people, and Om and Ali is for Hindu and Muslim, right? So Hindu and Muslim of India, they are brothers, and they combine together, they help together, they fight together against the English people. This is what we have done in 1947. So omalizumab. So omalizumab is the drug which is IgE inhibitor. Now we have the medicines which are steroids. Now steroids are the drugs which are given by inhalational route. So steroids are given by inhalational route. They are the drug of choice for maintenance treatment of bronchial asthma. So steroids which are given by inhalational route like budesonide, cyclosonide, fluticasone, these medicines are drug of choice for maintenance treatment of bronchial asthma, inhibitor of DNA of mast cell. Now we have the drug xylitol. Now we discussed that xylitol is a drug which is having the word I stands for inhibition, LEU stands for leukotriene, and on is for on effect. So leukotrienes cannot be on. So I means inhibition. So this is inhibitor. So this medicine is inhibitor of leukotriene on effect. So leukotrienes cannot be switched on. Leukotrienes cannot be switched on if I give xylitol. So xylitol is lipoxygenase enzyme inhibitor, reduces the leukotriene synthesis. So leukotriene synthesis will be blocked by xylitol. Now we have the drugs which are known as mast cell stabilizers. Now mast cell stabilizers are the drugs which will stabilize the membrane of mast cell, and when the mast cell membranes are stabilized, leukotrienes release is not possible. So the drugs which are leukotriene release blocker are having the word chrome in their name. So these medicines are having the word chrome in their name. Like for example, one drug is sodium chromoglycate. So one example is like sodium chromoglycate, or any drug which is having the word chrome in their name is leukotriene release inhibitor. So leukotriene release inhibitor is a mast cell stabilizer. Now we have some drugs which are leukotriene receptor inhibitor. So leukotriene receptor inhibitors drugs are montelukast and zafilukast. So montelukast and zafilukast are the medicines which are having the word leukotriene in their name. So these drugs are leukotriene receptor inhibitor. So montelukast, zafilukast are having the word leukotriene in their name. So they block the leukotriene receptor. The drugs are montelukast, zafilukast. Now these medicines have slow onset of action, and because of their slow onset of action, these medicines are not given for acute bronchial asthma. So montelukast, zafilukast not given for bronchial asthma because of their slow onset of action. Now we have some drugs which are known as bronchodilators. So bronchodilators are the drugs which are given to provide the symptomatic relief. Now these bronchodilators are four types. One is known as SAMA and LAMA. If you remember, we discussed these medicines in autonomic system like ipratropium, which is a SAMA, and tiotropium, which is a LAMA. SAMA drugs are those which are having the word buta in their name like salbutamol and terbutaline, and LAMA drugs are those which are having the metro word in their name like salmetrol and formoterol. Now magnesium sulfate is a drug which is given by IV route. Magnesium sulfate is given by IV route, and this medicine is always given for acute severe bronchial asthma. So magnesium sulfate is a drug given by IV route, always given for acute severe bronchial asthma. And the last drug was theophylline. This medicine can cause diuresis. This medicine can cause tachycardia, arrhythmia. So medicine can cause diuresis, medicine can cause tachycardia, arrhythmia, medicine can cause insomnia and seizures. So all these are side effects of this medicine, but the most common side effect of this drug is nausea and vomiting. So most common side effect of theophylline is nausea and vomiting. The other side effect of theophylline are diuresis, tachycardia, insomnia. We discussed that medicine is derived from tea and coffee, and what will happen if we consume excess of tea and coffee. So if we consume excess of tea and coffee, we will have nausea, vomiting, we will have diuresis, we will have tachycardia and insomnia. All these are side effects. Now theophylline is a drug which is losing its popularity these days. Now why theophylline is getting outdated? Because this medicine has lot of drug interactions. So theophylline has lot of drug interaction. Second problem, this medicine follows zero order kinetics. Third problem, this medicine has narrow therapeutic index. So drug has narrow therapeutic index, drug follows zero order kinetics, and drug has lot of drug interaction. Other drugs, medicine interact with other drugs. That's why this drug is getting outdated. Right? If the patient is suffering from bronchial asthma, for the acute bronchial asthma, we prefer to use nowadays formoterol. So we prefer to use formoterol with budesonide. So formoterol is a drug which is preferred with budesonide for the acute attack of bronchial asthma. If it is not given to you in MCQ, you can give salbutamol. So for acute bronchial asthma, we give combination of formoterol plus budesonide, and also we can give a drug known as salbutamol as a second regimen of choice. But for maintenance treatment of bronchial asthma, we discussed that the first drug to be started is always steroid. Now please remember, for acute attack, start both medicine together, but for maintenance treatment, always start with a single drug. But if the patient disease is not controlled, the patient bronchial asthma is not controlled, then you will add LABA to this treatment. So LABA drugs are added to the treatment of steroid, added to the treatment of bronchial asthma along with steroids in those cases where the bronchial asthma is not controlled. So this is all about the drugs for bronchial asthma, right? And all about this topic of respiratory system. One thing I have left over here, the side effects of steroids. So please read the side effect of steroids, because this is important. The side effect of steroids you will read by yourself. That is covered many times in your lecture, right? So that is all about these two topics.